educate, and encourage your women to motivate you through whatever you've been going through. We can talk about it. We ain't passing no judgment. Yeah, it's time to empower, educate, and encourage your women to motivate you through whatever you've been going through. We can talk about it. We ain't passing no judgment. So don't be ashamed. It's all the same. Stay in your lane. Your lane. It's whatever your real life looks like. Stay in your lane. Come out the dark and don't be ashamed. Your lane. Let's have a conversation on what we face every day. Tune into your lane talk show. It makes us feel good just to know we're not alone. No more will we feel isolated and cast aside. I want you to come out the dark. Just don't be afraid of your heart. So don't be ashamed. It's all the same. Stay in your lane. Your lane. It's whatever your real life looks like. Stay in your lane. Come out the dark and don't be ashamed. Your lane. Let's have a conversation on what we face every day. It's your lane talk show with Coach Trish Hannah.
And whatever time that you're listening to this particular show, this is your Lane Talk Show with your coach Trish Hannah, broadcasting live from Nassau, Bahamas. It's so good to be in your company today. I'm beyond blessed to be your host on your Lane Talk Show, a space designed to educate, encourage, and empower women of all ages. Here, we focus on healing, personal growth, and stepping boldly into purpose. We're focused on what it means to be whole as a woman, okay? Mind, body, and spirit, okay? Last Sunday, we hosted two beautiful ladies, Dr. Kitty Bonnie Roll Adderley and Katrina Conlive, who were living examples of that, the fact that the pain from the past doesn't have to define your future. Like, man, they were legit. All right. We spoke about the parent trauma. All right. The parent trauma that they experienced, the past, and how they are now raising their own children with intention, love, and a renewed mindset. So, of course, for those who may be struggling with the weight of your upbringing, if you found yourself parenting from a place, or if you find yourself now parenting from a place of pain, or if you're simply searching for hope and healing, you want to go and check that conversation out on YouTube. You can look up Coach Trish Hannah, Your Lane, episode 125. It's called Breaking the Cycle, Restoring Wholeness After Parent Trauma. And while you are there, please like and subscribe. Today, we'll be discussing part 2 of an important conversation, taking care of my skin and hair. We all want healthy, glowing skin and, of course, strong, beautiful hair. But with so much information and, I should say, misinformation out there, how do we know what truly works? So, just before we bring these ladies on, I want you to know that this is part 2, as I've stated before, because the first part that we had, that first series, we hosted a board certified dermatologist. Her name is Dr. Jamie Davis. Kudos to Dr. Jamie. I need to forward this to her. She's no longer, she's not in the Bahamas anymore. I think she's practicing abroad officially. So kudos to her. She said, whenever I do a show like this, make sure she's included. So on my break or at whatever point, I'll try to reach out to her. Kudos to you, my dear. Today, I am bringing to you, ladies and gents, because we do have men that tune into the show as well, experts to guide us, all right? And we have an esthetician who will break down the best skincare routines, treatments, and products for maintaining a youthful glow. And we also have a trichologist. I want you all to spell that 5 times. Don't even say it. Spell it 5 times, all right? At one point, you can get something wrong, okay? She deals with hair and scalp. She will share insights on hair loss, scalp health, and how to keep your hair thriving, all right? Your Lane Talk Show has various ways that we can be heard via Radio Star 106.5 FM, channel 976 on cable, and you can watch us on Facebook on Your Lane Life Coaching Facebook page. We're also found on YouTube Live on Coach Trish Hannah's YouTube page, or in the In Faith mobile app on your mobile devices. These ladies came bearing gifts as well, y'all. So I want you to tune in because we're gonna just be giving away, giving away, giving away. I mean, I asked them what y'all doing, and they come ready, ready to give back. So as always, y'all know Star FM phone lines. I don't know what's going on there. So what we're gonna do is we're gonna text. We're gonna WhatsApp. We're gonna text. All right. That's how we're doing it today. 1-242-376-8689. I have you to know, if you do not live on this island, you gotta know someone who live on the island who can get your product for you and ship it over to you or bring it over to you. Okay. Your Lane Life Coaching or Your Lane Talk Show is not responsible for dropping off the giveaways to you. All right. That's beyond me. That goes above my pay grade. All right. So if you only, I would recommend or advise if you know someone who can come and collect your gifts at the Nassau Guardian located in Oaksfield. That's Carter Street. Come, you can call, you can text, you could win your prizes. But if you are somewhere else in Jabim and you call in and you asking for the gift and want us to deliver it to you, I am sorry, we're unable to do that at this time. All right, so Your Lane episode 126, Taking Care of My Skin and Hair Part 2, is brought to you by John Shoe Store and Accessories, Your Lane Life Coaching, Emmanuel Medical Center. Take charge of your health with Emmanuel Medical Center, from annual physicals to managing diabetes, hypertension, and more. They provide compassionate, comprehensive care for all ages. You can call Emmanuel Medical Center at 393-9355 today. Emmanuel Medical Center, helping you achieve wellness. We're also brought to you by Dairy Queen Bahamas, DQ Bahamas. Free Cone Day is coming. Did someone say free things? Yes, free things. Mark your calendars because Free Cone Day is coming up on March 27th. Come treat yourself to DQ's world famous creamy, dreamy ice cream kitty cones on the house, of course. Spread the word and let's celebrate with a swirl. Who's grabbing one? Only at DQ Bahamas. We're also brought to you by Lysol Disinfectant. Sickness can spread fast, but with Lysol, you go into protect mode. Nothing kills more viruses on more surfaces than Lysol Disinfectant Spray, brought to you by Thompson Trading. We're also brought to you by Del Monte. And Del Monte is all about quality with non-GMO ingredients and BPA-free packaging. Every can is packed with fresh, nutritious goodness. Perfect for quick snacks or hearty meals. You can find Del Monte at your favorite food store. Fresh taste, smart choices. Distributed by Thompson Trading. We're also brought to you by Airwick. Oh, praise the Lord. Airwick, fill your home with the fresh, inviting scents of Airwick. From floral to fruity, warm to refreshing, there's a fragrance for every mood. With long-lasting freshness, Airwick transforms any space into a welcoming retreat. Find yourself and find yours today. And of course, Airwick is a home. Airwick in your home will make your home smelling nice and fresh. Distributed by Thompson Trading. And last but certainly not least, we are also brought to you by Fabulous Ronnie Hair Restoration Clinic. Hey, I know nobody making no noise in there. I don't. Oh, okay. I don't know. Attention, all men, women, and children dealing with dandruff, alopecia, or any hair or scalp abnormality. Fabulous Ronnie Hair Restoration Clinic is here for you. As the #1 trichologist in the Bahamas, Fabulous Ronnie specializes in restoration and hair health with expert care. They offer personalized consultations in a private one-on-one setting, ensuring you get the attention and solution you deserve. With 2 convenient locations, Bay Street and Faith Avenue, you'll experience amazing customer service no matter where you go. Plus, they're open on Sundays for your convenience. So don't wait. Take control of your hair health today. Give them a call at 341-HAIR or 565-0228 to book your consultation with Fabulous Ronnie Hair Restoration Clinic. Please, did you do the flyer? You did? Okay, because I'm looking at the screen differently. Okay, I just trying to make sure my girl's straight, because ain't no way I can help my client in here and I ain't doing what I supposed to be doing. I can get fired, Beats. Okay. All right, so we're getting straight into it. We have in studio today Dr. Sharron or Sharron. How do you pronounce it? I got it right the first time. Dr. Sharron Ronnie, because I know her as Dr. Ronnie Neely and Chloe Farrington. Okay, these are you have with us the trichologist. What I tell y'all the tri spelled 5 times, and then we have our esthetician. She said that she's a certified. What is it? She's a how do you say what's your position? Medical esthetician. So I going straight into it. I want you to introduce yourself, and then I also want you, Chloe, to find because I know because I just thought esthetician was esthetician. So I want you to tell the audience, let the audience know who you are, and then of course we want to know what's the difference between a medical esthetician versus just an esthetician.
Okay, well, I'm Chloe Farrington. Um, an esthetician and a medical esthetician both deals with skincare, so we both specialize in skincare treatments. However, estheticians work in salons and spas, and they will render services such as facials, basic facials, manicures, pedicures, waxing, things of that sort. However, medical estheticians work in clinical environments, so they normally work beneath a dermatologist, a physician, or nurses, and the treatments are much more advanced.
Oh, so
All
tell us a
right.
little bit about yourself. How long have you been in this field, and what is it exactly that you do? Like, some people specialize in certain areas, and some
Right.
people are broad and general. So, tell us a little bit about you.
Well, I'm 24. I would say I grew up in this field. My mom and my aunt are both therapists. I grew up watching them make skincare products, so I know how to make skincare products as well. I help clients who have hyperpigmentation, acne scarring, fine lines, wrinkles. So I do advanced treatments like microneedling, microdermabrasion, PRP facial. That's the new and popular treatment now that medical spas offers. Um, I do acne facials, I do waxing, I do massages, but I'm mostly known for my facials.
Mm,
But I can do all of those stuff.
okay,
All
good. Because
right.
we'll be asking a lot of stuff about face now. I need to know about these face stains now. I
Yes.
can't wait to get my answers. Right, right. And so, Dr. Ronnie, because that's how I ain't calling you Sharon. Because I ain't woman enough to be calling you bold Sharon like that. Dr. Ronnie, greetings and thank you for being a part of your Lane Talk Show again.
There you go.
All right, because our producer Beat say man, she work here. Because I was trying to see where her swipe is because she been here so much times. So welcome to the show again.
Thank you for having me
Yes,
again.
ma'am. So that for the two who don't know who you are, the two people in our country, because there's only two, l- let them know who you are, please, and what it is that you do, and what is a trichologist.
No problem.
Mm.
My name is Sharron Neely, better known as Fabulous Ronnie. I am a formulator, a trichologist, but of course, my heartbeat is a cosmetologist. A trichologist, to answer your question, is a hair and scalp specialist. So I
Mm.
specialize in any kind of abnormality to the scalp and the hair. And I've been in business over 2 decades. And so this is my passion, this is my
Mm.
love. I dedicate so much to making certain that, you know, I always have the answer to let persons know the answer is here.
My God, I love that. All right. So, for those who don't know, the answer is here today. The answer is here today. So, if you do have a question, go ahead and ask them. And if you want to ask anonymously, the number to call is 242-376-8689. That's 242-376-8689. Because there might be some questions that you don't want the people on Facebook to read, knowing that it's coming directly from you. So, go ahead and WhatsApp or text the question that you would want from any of these ladies. And sorry, 242-376-8689 is the number to text or WhatsApp. All right, if you want to ask an anonymous question. So we're gonna go right to it. Okay, we're gonna go straight to the point. The first question that I would want to ask Dr. Ronnie is because you said you specialize in skin and I'm sorry, in
Scalp,
hair,
yeah,
scalp,
scalp
and
and
the hair,
hair.
right? And so in that, we know that in most situations, especially in our country, we suffer a lot from alopecia,
Mhm.
traction alopecia, because we always talking about, oh, child, my edge is gone,
Mhm.
and all this other stuff. I know the last time you were here, you were able to share a little bit, but this is a new time because that was like probably 2 years ago.
Mhm.
So we're going to refresh the memory of everyone who may have heard you before, but just probably would have forgotten what to do and how to do it.
Okay.
Okay, so what causes alopecia?
Mhm.
What is alopecia, and how can it be prevented?
Okay. Alopecia is a fancy word for hair loss.
Mhm.
There are different types of alopecia. And so it all depends. That's why it's so important to have a consultation or professional assessment to
Mhm.
determine which type of alopecia
You have.
you have.
Mhm.
And once you have, I guess, established which type, then we'll know how to rectify it.
Mhm.
Not all alopecia is reversible, or
Mhm.
it can bring, you could bring the hair back to recovery, depending too on the severity
Mhm.
of how damaged the hair is. If there's scarring and any other factors that may be involved, especially if you have like a medical condition that also provoke the hair loss. And so, in terms of course, alopecia is a big, again, it's a really, sorry, it's a big issue. It's a
Mhm.
really, really serious issue.
Mhm.
It's a sensitive issue because it ties on to person's self esteem,
Mhm.
confidence. But I'd want the general public to know that, again, in order to basically do better, you would want to, start from somewhere
Mhm.
to correct a situation. It doesn't, you have to rectify it. You have to go into it rather than just thinking, you know what, I could wake up tomorrow and it could just go away. You want to find out what's the reason,
Mhm.
why it happened. And you made a mention of traction alopecia. I'm sure you just made a
Mhm.
mention. That
Mhm.
was traction alopecia, again, is somewhat self-inflicted based on poor style and choices. And so sometimes, especially with the popular lace, with the tight braids, again, style and choices. I like to use different analogies. And so the same, if you have a yard and you would always walk on one pattern in
Path.
the yard, you
Mhm.
notice what will happen. The grass in that yard will kind of, dissipate a
Die
bit,
off.
right?
Yeah.
It'll die off.
Mhm.
And it's the same thing. If you keep using the same braiding techniques or the same tension techniques,
Mhm.
again, that's where traction came into play. But again, there's different types of alopecia. You have universal alopecia, whereas there's no hair at all on the body. Again, that's a medical condition. Of course,
Mhm.
it is more tied onto your immunity. Then you have alopecia areata. Then you have telogen effluvium. Then you have so much different types of hair loss. But again, the main thing is establishing and knowing what is the cause and to know how to rectify it.
So, based on what you've been doing, because you said you've been doing this for years and
Hmm.
you've seen so many people,
So many,
right?
so
What
many.
is the most common alopecia or hair loss issue
I would
for
say
us?
at this point, again, in our culture, it's traction. Again,
Mm.
because it's just poor styling choices.
Mm-hmm.
Most
Mm-hmm.
time it's not even genetics. It is in some cases, but
Mm-hmm.
like you said, what is the top? And I would say traction.
Mm-hmm. I have my sister-in-law does not use brushes on her kids' hair at all.
Mhm.
Like she'll just comb it, or she'll just use some type of what was it she said, slick or something,
Mhm.
right, to try to hold it down, but she doesn't use a brush because she believes that brushing the hair can cause to pull the edges out. What are your thoughts on that?
I love the fact that, I mean, there's nothing wrong with the brushes, but keep in mind, it's a reason why we call it baby hair, because the front 3 inches from the where the hairline start into the Bella's hair, it's the most fragile hair. That's the front line hair. So when you pick up a comb, the first thing you do is go to the front. You wouldn't go to the middle and you wouldn't go to the back. It's to the front. So that's a lot of wear and tear to the very front of the hair. And so I guess
Yeah.
what she is trying to do is to prevent the friction and the traction from just the very front of the
Mm-hmm,
line
mm-hmm.
of the hair. So I guess that's a good thing. But in all cases, it all depends on what type of hair you have, especially if you have tight curls and a lot of shrinkage. You'd need to obviously, use styling tools to kind of give you a more polished look to the
Yeah.
front. But again, it's just even with children, like I notice a lot of, the primary school and right now, baby hairs is a big
Big
thing.
thing.
Keep in mind that's the front. It's so fragile, and most times once you basically lose it, that's the hardest part of the hair to kind of grow
Grow
back.
back.
It's
Yeah.
easy to grow the back, the middle, the top, but the
Mm-hmm.
front, it takes a lot more to, kind of rectify that particular part.
Mm-hmm. I don't know if I had asked you before when you were here, but I realized and I've seen where someone's grandmother is experience hair loss, right?
Mm-hmm.
And then you'll see the aunt experience hair loss,
Mm-hmm.
and then not the mother, just the aunt. However, the person has hair loss issues. So I don't know if you able to explain if these things skip just like everything else, because certain things in our genes they skip generations, etc. But hair loss is a generational thing, and if
Genetic.
so, is there any way that it can be prevented at all?
Mm-hmm. Excellent question. In terms of it being genetic,
Yeah. So if I know, for instance, if I know my mom probably have it and I still have my good hair, what can I do or not do to ensure that I don't get that same hair loss issue?
excellent question. I always tell persons just establishing and just knowing that, okay, this already in my blood.
Hmm.
That alone is just a vehicle, but you determine how fast that vehicle could reach the
Mm,
destination, even if it is in your blood. And so there are a lot of things. For example, Annie, Grammy, and cousin, they probably might have the same pattern of eating bad.
mhm,
They probably might have health conditions to see him who don't have high blood pressure, this one have
mhm,
sugar, low blood. And so again, you'd want to say, you know what, the bucket stops here. If they eat bad, again, let's slow this vehicle down. Let me start eating healthy. Let me incorporate healthy fruits and veggies.
mhm,
Let me drink more water. Let me exercise. And in the case if again, this inside of some families, especially when I do consultations, and if they say, my auntie have it, my mommy have it, and I said, okay, let's talk about mommy a little bit. You'll see the same pattern what would be presented mommy in the same family line.
mhm,
And so again, it's just establishing, okay, let's do something different to kind of curve the trajectory a bit.
mhm, mhm. Okay. So we'll I want to focus more right after this break on diet, because I hear you man I heard you mention diet on that. So
That's a
clearly that plays a factor
very
with your
big one.
hair. All right. So we'll talk about stress and hormones as well.
Very big one.
Okay, so let's do that. Let's take a quick break and then we get back to these questions. So we have someone ask, Dr. Ronnie Neely, how can I grow my sides? Man, you gotta listen so you can learn how to grow your sides, right? And I think this person has lost their sides grew to due to meds. I don't know
Mhm.
if that's what they're trying to say, but they said due to meds. So how do we deal with that? I know we're on a break on the radio. Just real quick, how can people deal with losing their hair due to medication?
In regards to medication, again, like I say, medication do have certain medications have a side effect again of hair loss,
Mm-hmm.
and I would advise them to speak with their physician to either find out how they can incorporate supplements to kind of cushion whatever medication it is that they're taking
Mm-hmm.
to still substitute to make certain that the hair follicle gets sufficient nutrients and vitamins. Supplements act as a good cushion
Mm-hmm.
to some medication,
Some.
some,
Mm-hmm.
but it's always best for them to talk to their physician.
I love.
Another thing too is again incorporate. Most times when persons are on medication, they don't exercise. Maybe fatigue, but depending on the
The medication.
medication, yeah.
Mm-hmm.
And so even if you could do couch exercises again to get the blood circulating,
Mm-hmm.
do something different. You have to be proactive in regards to your approach.
I love that.
You're listening to Your Lane with Coach Trish Hanna.
Welcome back. If you're just joining us, we have with us in studio Dr. Ronnie, also known as Fabulous Ronnie. Okay, and we have a wonderful esthetician. So I'm actually going to ask a few questions to her as well. But just before we do ask her questions, Dr. Ronnie was explaining about the diet, and the impact and the effect that it has on our hair, right? So I want to get into that. Like how can we balance diet, stress, hormones, etc. as a woman, because there's so much going on. All right, we already life done it done life in. Okay, so now we have to try to manage how to eat healthy. How to manage our hormones, how to manage stress, because at the end of the day, at some point, we always hear, "Oh, my hair falling out because of XYZ." So let's start with the diet. What is known to help with hair growth, or what is known to help to strengthen our hair, or what is it that we need to know about our diet?
Diet plays a very vital role. I have a scale, it's called a 70-30 rule.
Mm-hmm.
70 is internal and the 30 is external.
Mm-hmm.
But people typically would more lean on the 30, which is the lotion, the butters, the wax, the gel, or the potion and the motion what they
Mm-hmm.
can put on. But that's only 30%. 70% consists of the internal factors.
Right.
And a part of that is, of course, the diet.
Mm-hmm.
And if you're eating fast food, or even if you're skipping meals, if you don't eat, you have a lot of persons who just say, Ronnie, I just don't eat.
I don't have an
Or
appetite.
don't have an appetite
Yeah.
is an issue.
Mm-hmm.
But not eating, and then when you do eat, is the diet is terrible. It plays a very, very, very vital role in terms of how your hair will progress or degress.
Mm.
Now, the thing about it is, in terms of what it is that you're asking, fruits and vegetables are so much important. And even if you're just eating, let me just say fast food, not to call certain fast food. Let's say
Mm-hmm.
fast foods,
Mm-hmm.
and don't have any intake of lipids, especially when I do the consultation, Trish, and we use a very advanced scope. And once we put that scope on the head is talk a lot of people business.
Oh.
So it would basically say how much blood, how much nutrients actually go to the scalp. And again, it plays with the diet to say how do you incorporate foods, how do you incorporate water, how do you incorporate exercise, and what type of foods it is that you are eating. Is it high in, it all depends on what type of diet it is. So I would advise persons to just stick to, as long as you incorporate some type of greens, some type of fruits, some type of vegetables, to make certain that you have the right amount of lipids. Lipids is the building blocks of cells. Lipids is very much important. And if you don't have enough lipids, again, for regeneration, how you would get a new hair follicle, especially if it followed. And you don't eat fruits, you don't eat vegetables, but how is it going to do a regeneration of cells? It's not going to work.
Ooh. Yeah.
So fruits
Yeah.
and vegetables play a major role
Major
in
role.
that.
Yeah. And I would also advise drinking lots of water too. Because I see where, people's hair follicles and stuff die out as well. And you're the expert. I don't know. Because your hair dry, because you ain't drinking water internally, like you said. And then, of course, making sure that your hair is moisturized. So can we talk about that?
You know, it's the best moisture. I don't care what you could buy, Oprah Winfrey moisture bar. Water.
Water.
Water's the best moisture. So if you want, beautiful coils and not drinking water, that's like you saying you would be the hamster on the wheel. You gotta drink water.
Yeah.
You gotta drink water. I can't stress that. You have to if you want to hear. Like I don't care what kind of potion you use. You gotta drink water. You gotta eat healthy. You gotta incorporate fruits and vegetables. This is a part of healthy hair
Yeah.
care and scalp care.
Yeah. But not only that, drinking water plays a vital factor in our skin too. So we're gonna talk to Chloe a little bit about that. Talking about, but first of all, Chloe, right? I want you to know that my daughter's name is Chloe too.
Aw.
So, yeah. Let's write on for what Dr. Ronnie just said
About
as
the
far as
fruits and
water and
vegetables
vegetables
water.
and diet. Yes.
Right.
So talk to us about that and how does that help with our skin routines and issues that we may have.
Right. So I always tell clients it don't matter how much facials you book, how much good products you use, whether it's expensive or cheap, whatever you put inside of your body, it shows on the outside. For example, like Dr. Ronnie said, if you eat a lot of fast food, it's going to show. You're going to have a belly. If you drink a lot of soda, if you drink a lot of sweets, it's going to show and be like little bumps on your face. So you have to eat your vegetables, drink your water, take your vitamins that do play a major part in skincare. Some clients come in and they say, oh, they want tighter skin, they want collagen production, they want a nice glow. You could get these things by drinking water. You could take vitamin C. Vitamin C is rich in antioxidant, so it helps with hyperpigmentation, discoloration, blemishes, things of that sort. And a lot of people don't know the natural stuff works way better than other products they put on their face. For example, aloe. If you come to me, everybody who comes to me knows I always talk with two products, turmeric and aloe, because most of the clients I deal with, they have hyperpigmentation, they have discoloration. They want a nice glow. Spring coming up, summer coming up, ain't nobody into wearing no makeup. They don't put on their gloss and lashes and just go,
What do you see, because you say people come to you about what do you think is the biggest mistakes people make when taking care of their skin?
I would say, one, the poor eating habits. They eat whatever they want to eat. Two, if they do wear makeup, a lot of my clients, they don't, let's say, I would say, wash their makeup brushes as they should. they don't really see the esthetician as they need to, or even see a dermatologist in the skincare field. I feel like you should see a dermatologist at least once a year,
Mm-hmm.
just to make sure everything okay with that skin. And our next biggest problem is consistency. You have some clients who come in, if you would give them products to use, they would use it for a week and they tired, they don't want to use it no more.
Mm-hmm.
They don't see no results, but you have to be consistent. If you want the products to work, you have to be consistent. Don't use it one week or start using it again. You have to be consistent.
Mm-hmm.
So it's patience when it comes to skincare. You have to be patient and you have to be consistent.
I love that.
All
I,
right.
I also see, and I should know, but I hope I ain't offended no one. But I have seen, no matter where I go, I would say, oh Lord, let me be careful how I say this, right? I'd see the face nice and glowing and bright, and then I see
Then
the ears
the
little black,
body,
and then I see the hand little
the
dark,
knuckles.
the knuckles and stuff. So I mean, obviously this is bleaching, and this is
They're
what people
using
do.
skincare products,
And
right?
so can you talk to us about the dangers of using harsh chemicals like bleaching creams and soaps and stuff for the face?
Okay, before I even touch using bleaching treatments, right? You can exfoliate. Exfoliate means you can release dead skin cells by using a nice scrub.
Mhm.
You can use coffee scrub. So coffee, you could do your knuckles. A lot of people is scared like build up dirt in their knuckles, elbow, and underarm area. So exfoliating is very important when it comes to skincare. Bleaching is harmful to the skin, especially the first layer of the skin, which is the epidermis. So it damages the pigmentation in the skin, and it
Mhm.
also causes health problems. You could get kidney problems, you could get liver problems. So I don't recommend bleaching. Now I know a lot of clients they want like a natural color, they want to be bright, but you could get that by using turmeric. You could get natural glow facials where we use like products to help lighten those areas without having to bleach. Even aloe. Aloe helps with burn. Aloe helps with collagen in the skin. It helps with a nice smooth texture. So you can get these things by using natural products. You don't have to go and use bleaching cream because if you damage your skin, that's basically it. Some people don't get their color back once the
Right.
skin gone. That's it.
So let's talk then, because you going a little ahead of me, which is good.
Yeah,
Because no,
sorry.
that's fine. One of the questions I wanted to ask are, what are some home remedies? Because you have some people who be like, okay, well, I go into these different pharmacies, I go into these
Mhm.
different health places, and I go into spas and stuff, but then it's out of my budget.
Right.
So how can they do things at home, to help maintain? I know you spoke about aloe. So what
Aloe,
are some ways
turmeric.
that can be done, or what can they do to apply these things?
If you go inside your cupboard, if you have some turmeric, you could get the turmeric. You can make a nice turmeric scrub. So you'll need turmeric, sugar. You could put oil. I like to use grapeseed oil. That's an unscented oil because you don't know if they're allergic to coconut oil or almond oil. So grapeseed oil always is my go-to oil when I'm making products. So you can make a nice turmeric scrub to help with the hyperpigmentations, the blemishes, the dark shadows, acne scars. You could also use charcoal. You can make a mask out of charcoal too. That's good for collagen as well. If you have aloe in your yard, if your grandma have aloe, you could cut the aloe in the middle and you literally could wear that as a mask in the night.
Mm-hmm.
So aloe is very good for the skin. It's good for the hair too. It's good for the
Yeah.
body
Yeah,
overall.
let's go
So
for
you
that.
could eat that. You could get a nice detox. You could put that on your skin. It helps to keep the skin nice and firm, sorry, and tight. And it have a lot of great benefits. So if you can go to the spa, if you can afford to get products, you could always like use things at home. And
Right.
if you be consistent, you could get a good results. It's effective.
So when going to the store, then when going
Mhm.
to certain pharmacies and stuff, and someone's going through the aisles and they see all these different soaps, facial soaps and cleansers and stuff, what are some of the things that they should be looking for when purchasing products? And for instance, before even
Mhm.
asking that, how important is it to know your skin type?
Right. So that's what I was going to touch on first. I feel like before you go and shop for skincare products, you have to know your skin type. You have to know if you have oily skin, combination
Hey, who you
skin,
talking to?
acne prone, dry skin. So I feel like once
Put it
you
about
once
me.
you come in for a consultation,
Yeah.
once you tell your esthetician you're concerned, we recommend the best treatment for you. Then I'll go in and ask my clients what kind of products you're using now, and so we can know what all they're allergic to.
Right.
If they don't know their skincare type, they wouldn't really know what products to buy.
Mhm.
So I would recommend clients to go to their esthetician,
Right.
their dermatologist, medical esthetician first, so they'll know what to look for
So how
or
do you determine that?
which ingredients to look for. So let's say after you get a facial done, right?
Yeah.
Because some clients don't know their skin type,
Yeah.
and if they have a breakout with with the products that I use, I'll
Yeah.
know. Okay, well, I use salicylic acid on Susie. We can't use that no more because she had a bad breakout.
Mm-hmm.
Or I use retinol on Hannah. She can't use that. So as you start to get facials and I put you on different products, you'll know like what ingredients to get and what I shouldn't get when purchasing products.
Okay.
You understand?
Right. So let's say now I'm just trying to help everyone here. Yes, you have people who could afford to go to estheticians. You have people who could afford to go to dermatologists. But is there a home remedy or home way or a natural way to determine if your skin is your skin type? So if it's oily or if it's dry. I mean, you should know that.
Well,
But can you determine that?
you can most definitely. You can honestly look in the mirror and you can say, okay, well, my skin dry or dry skin. Most of my clients know that the skin type what they have based on their appearance. So if your skin always oily, you know you have oily skin. If you have bumps, you know you have acne prone skin.
Mm-hmm.
If it's oily and dry, you have combination skin. So most clients do know what kind of skin they have, but they probably wouldn't know how to treat it
Mm.
unless they come in and consult with an esthetician.
Okay.
All
So
right.
now that's a wonder. I love how you answered that. So let's talk about then if we go to the pharmacy, we go somewhere and we decide to go through the products, what should we look for someone with oily skin?
Okay, well, clients who have oily skin, I always tell them to buy products that don't have that much oil ingredients in it because the skin already oily and you don't want to clog the pores. And also use a gentle moisturizer. So I don't really put harsh ingredients when I deal with clients who have oily skin. So their skincare regimen will be like for sensitive skin only. So it'll be a sensitive cleanser, a sensitive exfoliant, a sensitive mask, nothing really strong because most clients who have oily skin clogs are already pores. You understand?
So for dry skin or combination skin, what do they look for? Combination skin.
For combination and dry skin, they could use like a lot of moisturizers, serums. They keep their skin hydrated. Because most clients with dry skin, if they keep it dry, it tend to get itchy. Once you start itching, then it's a breakout. So that's one problem leading to the next. So always make sure your skin is moisturized. Always make sure you use products that have SPF in it, that sunblock. I normally recommend my clients to buy a moisturizer that already has the SPF in it instead of buying a moisturizer and getting a sunblock.
Okay, so let's talk about that. Why should someone purchase a product with SPF?
Because if you go out in the sun, it's protecting your skin from sun damage. So me personally, I don't even have to go in the sun. I just put on my SPF because I don't want my skin to get damaged. So I put it on in the morning and in the night. But after
What does it do?
Pardon?
What does the SPF do? I mean, I'm talking as if because we know, but we talking so that those who don't know can understand.
So
So break it down.
SPF is another word for sunblock.
Yes.
And what it does, it protects your skin when you go out in the sun.
Yes.
So you wouldn't get darker. You wouldn't. Some clients just get sunburn. You wouldn't get sunburns. You wouldn't get those dark shadows beneath the eye. Some clients is even break out if they get a lot of exposure to the sun. So getting the SPF is very important. It would protect you from getting those things.
I love that.
All right.
I love that. All right. So let's talk. What are the best treatments for hyperpigmentation? Because you mentioned that as well.
Yeah,
And acne scars. So what would you use to treat those things? Would you recommend?
I start off with a facial, a glow facial, where I use products that have light in those areas. We also do microdermabrasion and microneedling. So for the hyperpigmentation, microdermabrasion is sands, the first layer of the skin. We use like little crystals, and it helps with the dark spots, hyperpigmentation, and discoloration. So clients normally get that done for discoloration. For acne scarring, we would recommend microneedling. So microneedling, we use a bunch of tiny sterilized needles, and we like create micro injuries on the first layer of the skin, and it helps with collagen production, acne scarring, stretch marks, fine lines, wrinkles, things of that sort. But if you're a first time client, I always start off with a facial first, and then we move up to the advanced treatment.
Someone said, I thought that black people don't need SPF.
No, we need that, man. We need that. Everybody needs sunblock.
I got that. I know
Everybody
that for a fact.
needs
We need
sunblock.
that. All right. Beats, you want to ask or say something? Go ahead.
Yeah, I just I was one of those people that for a long time I thought that hey, I'm black, I have natural sun protection built in. Until one day, I think it was carnival time, and I put some on and I stepped outside and I was like, what's going on here? Like, is the clouds are like, what is
You
happening?
felt the
Like,
difference?
it literally felt like I was in the shade the entire day.
Right.
Wow.
Right.
Crazy.
Yeah,
But I
yeah.
had one question, just to circle back to the lightning.
Mhm.
Just I'm not sure if it's a rumor or not. I heard it. You know, people say it almost in jest. I even heard it like as a part of a Jamaican skit one time ago, but this young boy named Panito or something about that. But it has something to do with you can get your skin lighter by staying indoors. Is there any truth to that?
Honestly, if you locked inside a place for a long period of time,
Your complexion is gonna come back.
it's gonna come back,
Yeah.
especially if you in AC. So yeah, that is true. If you want to turn a couple shades brighter, you could stay inside for a couple days in AC. That's true. That's true.
Okay. I guess it was a lie.
No.
So let's go back to Dr. Ronnie. Dr. Ronnie, what's up?
I like how she said it. He said it from the
I
About to
never
get the
been
mic
in
to
so
her.
long.
So Doc, let's talk about thinning hair, right? Let's talk about thinning hair in men. Yes, this is a women's show, but we got husbands, we got boyfriends, we got baby daddies, we got brothers, fathers, etc.
That's right.
Co-workers, to say the least, that may want to know information about that as well. So let's talk about how what would be the reasons if there is a difference with the way that women hair grows versus the way that male hair grows, right? How can we prevent thinning for men?
For men, it is
Hair thinning, sorry.
Yeah, hair thinning for men. Typically, male pattern baldness is primarily related to genetics,
Okay.
versus like we talked about the traction, but in some cases with male pattern baldness, again, it could be whereas drop off testosterone. Again, where that's the DHT would be obviously involved. And for every time a male would come in, I always would highly recommend them to, just get a general checkup with a physician because typically, men don't normally go to the doctor. They feel like,
No,
okay,
boy.
I'm not coughing, I'm not sneezing, and
I
I'm
have
not
no
falling
reason
out.
to
So
go.
why do I have to go
Mm-hmm.
in to see a physician? But most times it's just a lack of DHT. Most times it's a lack of testosterone. Sorry, especially with men. But again, when you do see men start the treatment plan, for some reason their progress, their results, it's come way quicker than females, especially if they stick to the plan.
Yeah.
They would have their recovery time is much more quicker versus a female.
So you think the issue, like you said, low testosterone or genetics? It's genetics because of the
It's something called DHT, and again, it's tied on to again a medical issue.
right. So they should see a urologist or their physician
Yes,
first before
yes.
coming to you. Is that what you
I
recommend?
would recommend that, but I mean, even so, I mean, a lot of persons say nothing is wrong with me, and sometimes too, you have a lot of men with locks, and those locks have a lot of weight.
Yes. And a pulse.
And so again, we could assist in that manner, and sometimes again, even with braids or even with stress. But it's just knowing how to manage it.
Yeah.
Stress plays a big role with the guys who normally come in.
Yeah.
And it's just having a conversation, how to kind of strike a balance from time to time. Again, with medical issues, again, see a physician. But we do help men, and men do reach the recovery point. Let me stress that really quick, really, really quick.
I like that. I like that. And so let's talk about then hair products like shampoos and conditioners. I mean, does it make a difference in the health of our hair, which type of shampoo to use? I know certain shampoos to say we don't have the this and parabens and all these other things. You have to ask there, but then at some point, something in it. They ain't really want to say, but something in it. So, how do you determine what is the best type of shampoo to use, and what to look for or avoid?
And that's an excellent question. Now, what type of shampoo? It all depends on what the situation is. For example, persons would say automatically to that question, sulfate-free shampoo. But if you are not a naturalist, if your hair is not natural, then if you do have, or if you just had a chemical service, you would want to make certain that is neutralized the shampoo. So that's a different type of shampoo. Or you would need, again, it's so many different types of shampoo, but it's just knowing, okay, what is it that we are dealing with? But I'll say, again, sulfate-free is the best. And I'll also say in terms of what type of products, again, go more to the natural because right now the beauty industry is getting is very scary, and especially me being a formulator,
Yes.
a lot of shortcuts happening. I would say that in big brand names,
Hmm.
but again, you'd want to go as natural as possible. You can never go wrong in nature.
You know what I realized with hair products? Hair don't lie, you know.
You're right about
Hair,
that,
the brands may lie,
but the hair
but the
don't
hair
lie.
doesn't lie. And
No,
I've seen that. And I don't want to say the brand on air, but there's a brand that was, I mean, Old Faithful to me. And automatically I knew that they changed the formula or they
there
changed
you go.
the management or whatever. And I found out when I did my research that yes, there was some type of exchange with who they had prior to. I mean, who they have now versus who was there before. And some of the products in there have changed.
It is.
All right. Because normally when you pick up, you already know that's your brand. So you ain't going to go pick it up and start looking behind the bottle like how you used to because when you first found out about the product. So when I realized that that was a change or there was some change in the formula of my shampoo and conditioner, I was like, no, let me go look for something else.
Trish, we live in an era where as cars changing, material changing,
Everything.
even construction changing. You
Hmm.
ain't think they definitely could change some,
Turn some things around.
formulation in the beauty
But
industry?
I'm wondering if they're doing that based on the fact that they're trying to cut back on their pricing and you know what I mean? Because the quality to me when I wash my hair with that product, it felt as if it wasn't the same. Like having to comb out my hair wasn't as like when I used to when it before the change, washing it, I could just literally put my fingers through my hair and whatever have you, and then the change it was a complete difference. In fact, it my hair fell out.
It fell out.
Yes.
I'll say this too, based on what you just said. And when I was studying formulation, we went to a very large factory. I wouldn't say the name. And in just doing a tour, um, they showed us a bottle, and it was say, let's pretend it was apple. And the apple was huge, and the marketing on this apple was beautiful. And the question was, how much apple actually went into that bottle? And they showed us, it was almost like less than a short size
Mm.
to this particular, let's say 12 ounce or
So they
16 ounce.
exaggerate a lot.
Listen. And
Yeah.
so again, we was like, but that's insane. How could the apple really be the active ingredient in that? The gentleman says, Mom, we are not here to make friends. We here to make money.
Oh, because that's marketing.
Okay, it's
Okay.
marketing. And so again, that's why I said if you could stick on the natural route as
Yeah.
much as possible. Again, even follow the particular brand
Mhm.
because again, even with the brands, just like what you say, even on TikTok and on YouTube, you have a lot of brands really even getting sued now because the
Mhm.
truth is coming out.
Yeah. Yeah.
And
Yeah, I
so
heard about that.
again, stick on the natural
As
side.
natural as you possibly
And let me
can.
brag and say, especially all the fabulous Johnny hair restoration products. Listen to me. We powered by nature. Let me brag on that, eh?
I love that. And guess what? We can talk about that because I want to know too. Let me tell you something. Let me tell you something. The people on here now done. In fact, you don't have to brag because the people who are on this link right now, they done they testifying. You could have a whole commercial with this link right now just by them just testifying. I can tell you that. We're gonna read a few of them in a minute. But there's a question that was asked was I know a family where the women have a tendency to go bald. Do you believe that this is testosterone based?
Woman or man?
They said women.
Testosterone, you mean estrogen,
And
basically.
well,
For
I
women.
am hoping that they no because I believe they're saying this based on the fact that you use testosterone.
No, I don't. You mean
But
me?
no, not you. You said testosterone, but you were talking about males.
Males.
So I
Yeah.
guess they want to know if that because
But in the case, I don't know exactly what it is that they're referring to. But if it is that, I guess we have made testosterone and estrogen, but I guess they would say a person, a female, probably have a little bit more. And so that's where the unbalanced hormone comes
right.
into play. And typically it would be related to a whole lot of medical condition, which
Right.
is not my pay grade.
Right.
I
That
am
goes
right.
Yeah.
That
Hold
right.
on, that's
What?
hard.
And let me
Right.
stress, I am not a physician, despite of my doctorate degree is not in medicine. And so I highly recommend persons to see a physician. I network with a whole lot of physicians. And so if there's a case or there's a situation that is brought to my attention and I feel that I could refer clients to the appropriate physician, I
Mhm.
do that. My objective is to getting that person to recovery under any means necessary.
That's what it is. And that's why you're highly loved. And I can see that right now. All right. So let me just direct this question to Chloe. Chloe, the question is, so aloe doesn't clog the pores? Just
No.
like,
Anything can clog pores, bacteria, dust, makeup, some products that you put on, but it depends on how much you use it. If you use too much of anything, it could clog the pores.
mm-hmm.
But aloe, if you use it like say once out of the week, because I recommend clients they can use it once out of the week,
Mm-hmm.
it wouldn't clog the pores, no. So if you want to add that to your skincare regimen, you could put on like as a mask in the night. You could do that. It wouldn't clog the pores.
Okay.
And you ain't leaving it on your face. You leave it on your face for like 5 minutes. Then you're gonna rinse it off in like 5 minutes, pat dry with a napkin, and that's it.
But if you're leaving it over the night,
No, for
overnight.
5 minutes, and then you're rinsing it off.
Okay. So you weren't sleeping with it
No,
on.
don't sleep with the aloe on. You can't. You can't. No, you can't.
Okay.
So as a mask, you don't never leave masks on. You leave them on for like 10 minutes, 15 minutes. It depends on what kind of mask it
okay.
is.
Okay.
All
I
right?
get it. You spoke about makeup, right? I wanted to know how often should we clean our makeup brushes and sponges, and why is it so important?
I recommend to clean your makeup brushes once a week or every 2 weeks. Every 2 weeks is a stretch. But if you can do it once a week, you could do it every 2 weeks. Makeup already made out of dirt. And you're using the brushes to apply the makeup on your face, right? So all that build up makeup, dust, particles, you have to clean them once a week because it could cause breakouts.
Mm-hmm.
Some
So how do you
clients,
clean it?
well, personally, I use an antibacterial soap,
Mm-hmm.
but you could go on in with a gentle cleanser. It depends on your skin type
Mhm.
and what your skin could take.
Mm-hmm.
I use like Defense. I get lukewarm water and I scrub my brushes with the soap. And then afterwards, I have it on a napkin and then I pat dry. Now, once you pat dry, don't ever like use the towel or like squeeze out the excessive water because it could damage your brushes.
Mm.
So just get the lukewarm water
Mhm.
with your soap, take all that makeup out, all that dust, all that goo, all that gunk,
Mm-hmm.
and then let it dry.
Yes. Go ahead, Beast.
Would you recommend just boiling it?
People do. You could boil it.
Sorry,
as
the
well.
question is, do you recommend boiling it? Because I know you may not hear what Beat said. Do you recommend boiling
You
your
can.
brushes?
You can, or you could just use lukewarm water.
Mhm.
Once the water hot, to get all the makeup and dust out. That's basically what kills the germ.
Mhm.
The hot water and whatever cleanser you choose to use.
So
All right.
you have some now. I don't know how I can ask this question, but
Mhm.
you have some people who go to different makeup artists,
Mhm.
and you don't really
Mhm.
see them. I don't know if they do it prior to or whatever have you, but you don't really see them cleaning because they can never try to clean in front
Especially
of
if
you
they in
or
between
picking it up.
clients,
Right.
right?
So how do you deal with that? I mean, what would you recommend for someone who may go from a client to the next client using the same brushes?
Honestly, you have some clients who are very much, how to say this, particular, and they would
Mhm.
ask, are those brushes clean? Or can I bring my own brushes? Because it happens,
Mhm.
especially if the makeup artist is really busy. They don't have time. They'll probably wash it that morning
Mhm.
because they know they have like a full day, but they ain't gonna be washing them brushes
Like
in
the bridal
between.
parties
They
and
can't, yeah, they
Junkanoo people.
can't.
Yeah.
Especially if the person's skin sensitive. Most clients who I know who have sensitive skin, in particular
Breakout.
with their skin,
That's me.
they'll bring their, some people just bring their brushes.
Mhm.
What about even if they sanitizing it? Because I noticed they would always use alcohol. How
They can sanitize it, but then at the end of the day, you have to make sure that brush clean and wet and dry. Because if you sanitize it, if you don't dry it out with scent, you can't really apply the makeup how it's supposed to look. It'll be damp and then your makeup will look wet. So
You have some people who dampen their sponges, and that's a new thing. You heard about that, Dr. Ronnie? They dampen their
They've dampened
sponges and
before.
their brushes to apply the makeup to ensure that it's done. I guess this new effect that they have.
Mhm.
So I don't know if that would probably help. I don't know.
That's still ain't helping man because they
Yeah.
dampen it, they ain't cleaning it.
Oh Lord.
Because when I put on my makeup, I stamp my brush too.
Yeah.
I stamp my brush,
But
but
it's not. So you.
they ain't cleaning it.
Yeah. So by doing that, that could cause a lot of like effects with rashes and
It will,
breakouts, etc.
especially like I say, if the client have sensitive skin,
Mm-hmm.
because you have some people, their skin so sensitive. If they smell something, if they're around something, what they eat, what they allergic of,
Breakout.
freak out. Like me personally, I allergic to shellfish. I can't be around crab, lobster. I will have rashes on my face. So with that being said, clients for sure who have sensitive skin, I highly wouldn't recommend bring your own brushes, just in case, because you're dealing with different skincare types. You don't know what the person have on their face because a lot of clients too they have problems beneath the makeup. You understand?
Yeah, we're gonna take a quick break because I want to know some more. I want to know how can we take care. It's got to be more to this, and some questions coming out now. So we're gonna answer those questions right after this break.
That's why I don't like getting my makeup. So yeah, some people you ever
Let
look.
me read a few of these things. Listen, we on a break from the radio, but they can still hear y'all. I forget to tell you that. No, that's all right. That's all right. If you want to continue a conversation, let's have a conversation. But I wanted to read some of the information on Facebook. Go ahead. I don't want to stop y'all.
That's what I was saying with the makeup situation, right? You ever see how some makeup artists post before and after photos, right? Makeup is used to enhance beauty, right? But why so particular with getting my makeup done? You have some, some clients they have acne prone skin or they might have rashes. You don't know what caused that.
Right.
You don't know if it's contagious. And I used to look at all that because if she just finished getting her face beat and a rash on her face and then you're going with the same brushes, I don't know if I might get that. So that question which you asked is a good question. And a lot of people they don't pay attention to that.
Let me read some. I have time. I just want to read one or two things here. It says, I got a treatment and wash from Dr. Ronnie. Let me tell you, my hair is still thick and rich. I stopped going to my main hairstylist because of trauma. I lost my mom in 2023, so I haven't been to a salon since. But Dr. Ronnie wanted to treat me. It was awesome. All right. Someone says, oh, and she continued with service with smile and juice. The staff matches the atmosphere, right? I know, but that. Someone says the hair oil with rosemary in it is the sauce. Okay. You can just look at Dr. Ronnie hair, always on point. I mean, that's the truth. Listen to me. No, but I've seen some hairstylists, I ain't gonna lie. They know how to fix other people's hair, but then when they in the salon, that's probably because they don't have time. So I'm not gonna bash no one on that because that's fine. Because when they do go out, they be on point.
You're listening to Your Lane with Coach Trish Hannah.
Welcome back. This is the time because I know if they don't remind me, I'm going to forget. All right. There are times that I've had shows where I just ask the question at the very last minute and forget that people bought their giveaways. Y'all pray for me. All right. So I'm going to take a minute to ask a simple question. And this question is basically give me 3 pointers, really good pointers about good hair care that Dr. Ronnie would have mentioned. 3 good pointers about good hair care that Dr. Ronnie would have mentioned. All right. And the number to text is 376-8689, 376-8689. Dr. Ronnie, tell the audience because I telling them we giving away things, but I ain't telling them what we'll be giving away.
We bring a lot
So
of goodies in here.
all kind of goodies
A lot
in
of
here. I
goodies
can
in
tell you
here.
that. All right. So what? Because I see a bunch of things. So it's all in one, or it's different things for different. What are we doing?
There's different things depending on how many questions you have. I have the prizes for you.
There you go. So this is a juicy question and a simple man. Y'all should know this. And for those clients who been the Fabulous Ronnie and who know how this thing go, y'all should know the answers automatically. All right. 376-8689. Give me 3 good pointers that she mentioned to taking care of your hair. All right. So we're gonna do that. And then what you bring?
I bought
Chloe.
3 products. I brought a turmeric scrub that has, turmeric helps, like I said, with hyperpigmentation, discoloration. So if you want a nice spring glow, I brought that. I also brought a niacinamide serum. Niacinamide is good in keratin. That's a protein found in the skin. So it helps with skin health. So it'll have your skin looking healthy, tight, and firm. And I also brought a sensitive cream for my clients who have sensitive skin. So I bought 3 good products.
3 good products.
3 good products.
So we can give away, this one could be, how should we do this? Because I know that was a juicy one that Fabulous Ronnie have there. But I tell y'all the WhatsApp how y'all get commented on the message. All right, so that's all right because we supposed to we WhatsApp in, but that's fine. Pull up the answer. Her answer. This is from. You want to read it?
What
Go
is
ahead.
radio? That's my class.
So the answer that we got from Miss Radia Cleomia, if I'm saying that right, is number one, it's the food you eat. Number two, you have to take your supplements. And number three, you want to see a professional when you have some issues with your skin or hair.
All right.
Good job, Radio.
Okay.
She's a medical esthetician, by the way. Hi, Radio. We went to school together.
All right. That's incredible. That's incredible. So, Dr. Ronnie, what is she winning today?
She definitely got a $25 discount off having a hair consultation or an assessment done. So $25 off your bill already.
Automatically. Hey, come on. Come on. All right. We saving money in here today. Oh. All right, so ladies, let's talk about then, because I have a lot of other questions, but I want to talk more about what y'all do, man. So we can start with Dr. Ronnie. Dr. Ronnie, talk to us about the products that you've created and the products that you sell, and why are they so important, or what differentiates them from those other products that are on the shelves?
Excellent question. Of course, most of the products, the main ingredients are indigenous botanicals. I have things such as the aloe from your Grammy backyard, to let my friend say.
Yes.
We have a product, it's called Aloe Bath. It is amazing. It soothes the scalp and it's excellent for persons who have severe dandruff. I have the light protein treatment, which is the rice water. That again, that's the game changer, especially if you have shedding. And by the way, that's one of our giveaways as well. I also have a restoration system, which consists of the restoration shampoo, the conditioner, the treatment, the moisturizer, the growth oil. And again, it's a 5-piece system. And it collectively works hand in hand together. The success rate on that system is impeccable.
Wow.
And again, created, formulated by yours truly. And just to even ensure you know that, yeah, I love to big up my Andres, my island, my Andres. You getting real Bohemian,
from the big yard.
From the big yard. Because of course, just I grew up with my Grammy. So I grew up with her grabbing us and saying, if your hair had any kind of abnormality, we got washed with the pawn bush. And I have pawn bush, by the way, especially for persons who have dandruff, seborrheic dermatitis, even if you have braids and it's itchy, that pawn bush, listen to me, that's the remedy. But down the pawn bush Grammy washes in, but it's similar to, it's the professional grade. And
just before you state what's next, I wanted to say that I have a co-worker in our advertising department that has issues with dandruff, severe dandruff, and she puts on a wig every day. Beautiful hair though, beautiful hair. Because one day she came with hair, and then the next day she put the wig back on, because she said that it just flakes out, like while she doing stuff or whatever, you just see the flakes, and if she scratch, you see it all over her clothes. So how can she be helped in situations like that?
We bring persons to an amazing recovery point. Again, if you know better, you tend to do better. Again, it's to know what to do and what not to do. And especially if you have any abnormality with the scalp, first come and book a hair consultation. The hair consultation with me is a 30-minute professional hair assessment, whereas I take my time and I scan through everything I need to know, and you would find out a whole lot of things that you did not know even about your hair. And I also use a very advanced scope, but I get to see with more meets the eye, find out what's going on. And again, like my lady said, consistency is a big deal. Even if you do have like a shampoo or any kind of cream or balm that you would consistently use. We're talking about dandruff.
Right.
Being consistent with it. Being consistent is a big deal.
Yeah.
And I love that you stress that. And that's one of the issues. Because they use it 3 times or 4 times a day. I diet.
But it won't go to something else.
Yeah, but consistency is a big deal. Like Glada, you really, and that's the truth. Consistency.
I love that. So continue. Let's talk about some of the other things. So you do have something for hair loss, and you said that certain hair loss cannot be treated or reversible.
Yes,
Right. So
there
certain
are
things, even if you do, but you can tell based on the consultation that, hey, I already
automatically,
know that these
automatically.
products would not make a big deal. Can you, because there was one I knew for a fact that I heard that does not, that's not reversible. It's um, chemical alopecia or chemical
Let
burns, I think.
chemical burns, it can be tied on to scarring,
Hmm.
alopecia, and scarring is when the opening that the hair is that the hair exit the scalp, it completely closes. Almost like you stop wearing an earring, the skin naturally closes up.
Hmm.
That, I mean, in a case like that, that's where you'd probably have to do like a hair transplant or what's not.
Transplant. Yeah. Yeah.
But I wouldn't advise person to even allow it to go that far. But in terms of the type of alopecia that is not reversible at all depends too on how aggressive it is and
Hmm.
how far and how long you've been dealing with it. Now, keep in mind, I've had clients with conditions back to even 20, 25 years,
Hmm.
and we actually bring them to a safe recovery point with the
Mm.
hair. So the time frame doesn't matter, but again, is how
Consistency.
consistency.
Yeah.
Listen to me, let me stress
Yeah.
consistency. I need to put a whole billboard with the consistency. I
Yeah.
like that. Yeah, and patience.
Hmm.
Heavy on the patience, like one of my clients said, heavy on the patient.
Hmm.
They're the two recipes automatically. 'Cause you could have something good, but how would you know it could work if you don't be consistent and
Hmm.
patient?
Okay.
Nothing is a one hit wonder.
So here's another question. What products do you recommend for dandruff buildup?
Okay, for of course the Fabulous Ronnie line, we have something called Dandruff Eraser. It is amazing. It does exactly what it says. It's
Mm.
a dandruff eraser.
Hmm.
We have charcoal shampoo. It's down home charcoal, all natural charcoal. It works amazing. We have rosemary shampoo. We have in our dandruff lineup. Again, if you come in clinic, we have like a pink sun scrub for the
Hmm.
scalp.
Hmm.
We have something called microcrystals, whereas we literally soothe the scalp. We apply it to the scalp. Obviously, help with the inflammation because most times clients have dandruff.
Yeah.
It's a lot of inflammation that
Hmm.
backs it. We have again detox. The detox is really popular. The detox is one of our top selling
Talk to
services,
us about it.
especially for dandruff, but not in particular. I don't want to just keep bungee jumping on dandruff because
Right.
there's so much. You have seborrheic dermatitis. You have there's so much other scalp abnormalities.
Issues. But
Yeah,
let's talk
issue.
about this detox because you always have the detox with your
Oh,
body,
child,
but you
listen
don't
to
have the
me.
detox with the scalp. So talk to us about that.
Again, properly cleaning the hair.
Mm.
Our culture consists of braids,
Right.
sewing, caps, and again, the hair is very porous.
Hmm.
And imagine when you have a client and she say, "I had my weave on for 2 months." That's like you said you had them clothes on for 2 months.
Mm-mm.
How clean would your body be? And
Not
if you
clean
do
at
take
all.
it off, you just jump in the tub and you and do a cowboy. How clean so would your
Hmm.
body be?
Hmm.
And so it's just basically doing a detailed cleaning in the shaft of the hair. And
Hmm.
again, making certain that the surface of the scalp is properly taken care of. And so the detox, we have several types of detox. It's just not just one, but our main one consists of a whole lot of steaming, and we take time and kind of sieving through the head and make certain that every part of your head is properly clean
Ooh,
versus just a
child.
squish, squish, squish. It ain't a
Mm.
squish, squish, squish in there.
Listen to me. When y'all
No.
want y'all, you know how y'all take your time to go to spas?
There
Y'all
you
take
go.
your time to go to Fabulous Ronnie.
But
Because
that,
your face ain't the only thing would need to get done because you need
no.
your hair done too. While she was explaining that and she said how you go through each scalp, all I could envision all the little thing. I come in. I come in this weekend. I come in and the little steam coming up.
Of course.
Oh, yes.
Of
Oh,
course.
definitely. So,
Detox with like lemon and vinegar. Something I was watching online.
Yes, you have, like I said, it's different types of detox. So once you've had a word detox, it's just thoroughly clean the scalp
the
and the
scalp.
hair.
I
Yeah,
love
once
that.
you had detox.
I love that. All right. So Chloe, let's talk about you and the things that you do. You take the mic over. And what are some of the products that you would recommend that you have done, that you've created?
Well, I make soaps. I do aloe soap, uh, aloe soaps, turmeric soaps, charcoal soaps. I make body scrubs, body butters. The treatments that I do, microneedling, microdermabrasion, anything that's used with the skin, I do.
Mm-hmm.
Right? So I like to help people look good. I feel like once you look good, you feel good, you do good, you know?
Mm-hmm.
So That's me.
So what about the like what type of soaps do you create and for
Mm.
what? Like you said the
Well, charcoal, mostly people who
what is
have
it?
like burns
Mm-hmm.
or discoloration, I would recommend that. Turmeric is good for hyperpigmentation, discoloration. I do sulfur soaps as well as good for acne. So it
Mm-hmm.
kills bacteria in the skin. So basically, once you tell me your skincare concern or what you want to work on, I will be able to recommend the correct product for you and the
Mm-hmm.
correct treatment.
Okay.
All right.
Okay. So where can people find you if
You
they want to purchase your
so
supplies or even your services?
yeah, so I'm located at Essence Medical Spa. That's in Palmdale. Or you could search on my business page. That's Sawyer Chanel. My contact is 816-1338. So if you want to work on anything, whether it's your skin, the wellness of your body, if you want to lose weight, if you want to enhance how you look, you could just come at Essence and ask for Chloe. We do a full body consultation. All
I
right.
love that. I love
So
that.
if you come to the spa and say, okay, I'm booking for a facial, we do a full body consultation. We ask you about the wellness of your body. If you feel tired, fatigue, if you want to work on your stomach areas, a full body consultation. Just in case you want to work on something in the future, we have it on file.
Mm-hmm.
All right.
So when someone comes to you and say they want a facial, they've never had a facial done before,
Mm-hmm.
right? What are some of the questions that you ask?
Mm-hmm.
And what because I know it's various types of facials,
It's different,
types of
right?
products and all these
Mm-hmm.
different things. So how do you recommend what is needed for who?
Okay, so like I say, we do a full body consultation.
Mm-hmm.
It's like a skin analysis. We'll ask questions like what products you're currently using, if you have any allergies. These questions are important. So when we do the facial, we know what product to use or what the client could take and what they can't take. We ask about their diet.
Mm-hmm.
We ask if they had any surgeries before in the past and things of that sort.
So even if they see like the pamphlet would have this a nice one now, this one said this come with scrubs and this come with exfoliating this and this what they want. You still will go
So
and
yeah,
ask.
and
Yeah.
that's it. There a
Yeah.
lot. Say you have some clients who are knowledgeable about skincare
Mm-hmm.
and the skincare treatments, and then you have some who don't know anything, and that's fine because
Mm-hmm.
that's why they come to the professionals. But
Mm-hmm.
let's say, for example, if you have acne prone skin,
Mm-hmm.
right? And social media is a big to do. Some clients will see stuff online and just because they see somebody getting a treatment and they want to try it, which is perfectly fine. But if you're not a candidate for that treatment, me personally, I wouldn't administer it because it probably could lead to more problems.
Mm-hmm.
So let's say if you have acne prone skin and you come and say, okay, you want microneedling done, I would say, okay, I understand this is probably a treatment you're interested in, but you're not a candidate for that. You understand? If you have acne, I will give you an acne facial. I will use products to treat your acne. All right. So some clients do come and say they want this and that, but you can't give the clients what they want. You have to give them what they need.
Oh,
So you have to recommend the correct treatment.
and I would prefer going to someone who would
Mm-hmm.
recommend what I need versus just
Yeah.
saying what I want. Because when if I just you just give me what I
What you want.
want, you know what I
It
mean. You there's
necessarily
no
wouldn't
you
treat
just
your
trying to get my
problem,
money.
right?
You know what I mean. So definitely that's actually a really good thing to
Right. And I'm
right
glad how
but
you brought
business
that up
ethics.
because a lot of people, like I say, social media, if they see something on social media, they want it, but I have to make sure I treat you the right way. If you don't need this particular treatment, I wouldn't do it, you know?
So let's do a giveaway for you. Same question with Dr. Ronnie. We're gonna ask, okay, so give me 3 points. Now, if you didn't win something, like my good friend here, Radia.
And radio quick too.
Right. So
Radio
Radia, you
quick.
can't come back on this one. So we're looking for new people, okay? Just in case, because we've had that. So right, because the mic picks up. So what the question is, give me 3 points from Chloe to help with your skin. All right, 3 points that she mentioned that will help with taking care of your skin. So you're gonna text or WhatsApp 242-376-8689. Okay, so three um pointers to help affect what am I saying? 3 pointers to help to take care of your skin that Chloe mentioned. Now you can't come with your own answers. All right, you're gonna say what this marvelous medical esthetician has stated today on our show. All right, so as we wait for those answers, you can go ahead.
A treatment that I wanted to touch
Mhm.
on,
Go ahead. Yeah, yeah.
since the topic is taking care of your skin and hair, is at the spa we offer PRP. So PRP stands for plasma riches platelets. So it's a PRP facial. So what we do is we take a small amount of the blood and we place it in like a centrifuge. So the centrifuge it separates the platelets and plasma from the blood.
Mhm.
And once you take it out, it's like a golden color at the top and then like the red color at the bottom, which is your blood. So for clients who have hyperpigmentation, dark shadows beneath the eye, acne, scarring, and things of that sort, we recommend that facial treatment. So
Mm.
we use their blood as a serum over the face, or it can get injected. And we would just use the sterilized needles to drag it all over the face.
This thing go deep.
It goes deep, but not only that, it helps with alopecia and hair loss as well. So yeah, so we have clients who come and they get that done on their face. People call it the vampire facial, and they get
Wow.
it done for alopecia. So I just wanted to bring that up since the topic is taking care of your hair
I
and
love
skin.
that.
And
I love
because you
that.
made a mention of PRP, of course,
Mhm.
because you made a mention of PRP. PRP is a huge, big comeback, especially in the hair loss industry.
Mhm.
And for me, like I said earlier, I network with physicians,
Mhm.
and one of the physicians that I typically network with would be Dr. Nina Graham. She's amazing.
Mhm.
And again, I would then, if it is to that case, then I would refer persons to her
Okay.
for the PRP. But I don't do the PRP.
Mhm.
But I'm glad to know that I know now that y'all do the
Mhm.
PRP, but y'all do it with the face, y'all do it with
Yeah,
the
we do it
hair.
with the face and hair. So clients are coming for hair
There you
loss
go.
and they like inject the needles.
See, now that's another thing. Not
Yes.
all cases I would recommend.
For
Y'all, they having a
alopecia.
whole conversation on the show, and only I ain't catch it because I getting the answers from the people who texting me. I mean, a whole conversation. Okay, so we have Phoebe Scott. Congratulations, Phoebe Scott. Her answer is drink water,
Mhm.
wear moisturizer with SPF, and
Uh-huh.
wash your brushes.
That's
All
right.
right. So what
All
is she?
right.
What is she getting, Chloe?
So she's going to win a niacinamide serum. Like I say, niacinamide is good for skin health and it helps to keep the skin looking nice, tight, and firm. All right.
So and oh Lord, now you got to give something to someone else because they
answered
sent
you.
yes.
I have two
So
more
this
gifts.
is okay. This is Yolanda Edwards. She said, Yolanda, you delete the message. Oh, see there. Eat healthy,
Mhm.
clean your tools or your sponges,
Mhm.
and wear sunblocks.
That's
Okay,
right.
give us
That's the
something
same
too.
thing.
Yeah.
She
So
get
we're
the
gonna give
turmeric,
you.
the turmeric scrub.
Yeah. All right. So we're gonna do that. Dr. Ronnie, we have other prizes from you. Man, let's go. What we doing? Let's ask a question. Name the two locations
Oh, yeah.
from where Fabulous Ronnie is located. All right. There are two locations where Fabulous Ronnie is located. You name the two locations, and what are they getting?
They're going to get the all natural protein, the rice water, the typical notorious
Oh,
rice water.
child, they can
I
get
can
the
tell you
rice
that.
water. I can text myself.
Of course.
554-3367.
The
No,
notorious rice water.
come on,
Listen,
man.
that
Who
rice
want this
water don't
rice
stay on the
water?
shelf long at all.
376-8689. You get your ice water. You have to give me the two locations where Fabulous Ronnie is located. All right, and it will be yours. Okay, so ladies, am I missing anything? I'm trying to think about because we talk about dandruff, we talk about alopecia, we talk about the face as far as makeup is concerned, the brushes, the type of the fact that we should use supplements. We spoke about drinking water and how imperative that is. We spoke about nutrition, the types of fruits, making sure we eat lots of fruits and vegetables, less on oily fried foods and more of the natural fruits and vegetables and things that you could perhaps bake. We didn't really say that, but I just wanted to put that plug in there. But am I missing anything as far as taking care of our hair and then taking care of our skin? But
I
you go,
think I'll
Dr.
probably
Ronnie.
tie in with both entities.
Mhm.
Prevention is always better than cure.
Mhm.
So there may be times where persons may not have any issues with the facial, with the skin
Mhm.
in the face, or even with the hair.
Mhm.
Again, but you'd want to know what not to do to prevent
Right,
going
right.
Mhm.
on that lane where you do
Mhm.
not want to end up. And so prevention, you have persons, I don't only deal with persons who have an issue. I have persons who come in for just proper hair care.
Mhm.
I mean, these people have long and thick and it's beautiful, and they say, hey, I want to keep this. I want to make sure I know how to always maintain this. And it's sometimes they come with a whole wealth of knowledge. They already have a system in place, and it's just now tweaking it, modifying it to even be better, you know?
Okay, so
So we do hair care as well.
Yolanda, you can't answer. You didn't get a prize, Yolanda. You can't answer the question again. In fact, I extended it to you because I wanted the first person. So I can't give you that. So someone else, text the number 376-8689. We get let's be fair. Just a little for tonight. And you text the number, give the answer. That rice water is yours. And if you ain't texting, Then I take in the rice water home. Okay. So what else is there? Because I want to make sure we get everything that we could possibly get. I want to ring y'all out with information from the information needed for these people tonight before y'all leave. What am I missing?
I would say to my male clients, most of the clients that I deal with who has like bear, they most of the problems they have is ungrown hairs, ingrown
Ingrown.
hairs. So with ingrown hairs is when the hair grow beneath the surface of the skin, and when it starts to grow, they normally be inflamed or can cause an infection. So the way about I go about treating it, I would use like a warm towel to suppress it. Then I'll express it and take those ingrown hair out. So the treatment that I would recommend is electrolysis or laser hair removal. I just had to touch on that because a lot of clients has have that problem, especially males. So throw the razors away.
Do you deal with using lasers to remove moles as well?
We do that as well, yes,
Yeah,
ma'am. But the
okay.
doctor does it.
Okay.
Yeah.
All right.
Mole removal.
I
Mo-
want
mo-
to piggyback. I want to jump off you. Removing the hair. With me, I have a product. It's called Beard Balm to help you to grow the beard. And so you have a lot of men with a patchy beard, and they want to kind of give a fuller beard. We have a product. It's called Beard Balm. It is amazing to help to bring the entire beard into one. So you take it out and I put it in.
That's
I
something.
like how she brought that up because I can say it because my clients know why I say how I feel.
Right. Yeah.
I treat the ingrown hairs, but I said the little bears be too patchy.
Oh.
And I'm glad how you bring it up so I can recommend them.
Of course.
The bears be a little patchy. I can
Well,
recommend
that's
them
what I was
you.
going to say. After
have
you
to
done finish with their hair,
recommend
their beard, just go sit, tell
Because
them.
I already treat the
to
problem
Dr.
with the
Ronnie.
ingrowns, but it's
Mhm.
another problem.
There is
It's
an
a
issue
patchy.
that I wanted
is.
to ask. Well, not really necessarily an issue, but I've discovered that men, when they go to the barbers use these black sprays on the hair follicles just to help it look more full and natural. What is your thoughts on that? And is it safe? Do you think that it's safe for men to use?
Again, I notice a lot of guys will have like a receding hairline, and we want to feel confident. And
Right.
so I wouldn't say that there is a problem use it, but excessive usage is a problem.
Right.
So if you do use it, or if your barber use it, you just want to be moderate to say, hey, I know you use this every time you cut my hair. Again, you could even change up what product it is that you may be using. Some products are more harsher and more heavier than others. Versus they got the fillers, then you have the spray, then you have the rinse. And so again, sometimes people even have allergy to certain things that may be used on the hairline. But no, it doesn't affect it. I wouldn't say it does not affect it.
That's a question. Go
But
ahead.
again, it's to build confidence to it. Nobody want you don't want feel inadequate. You don't want to feel like, okay, my hairline, my hairline moving. But I would still want feel youthful. I still want feel look good. And so a little brusher too. I'm not against that.
Okay.
I'm
Once
not
in a
against
while,
it at
just
all.
not excessive use, right?
Not excessive use.
Okay. Yeah, we do have an answer. Faith Avenue and Bay Street.
Mhm.
Okay, so the person didn't say their name. So we're just waiting on them to recite their name so that we can beat you writing these names down. Nancy, you writing? Yeah, write the names down for me, the winners, please.
So the barbers, and especially I network.
Nakira Barnett, congratulations. And I think you won the rose water.
The rice water.
The rice
Yeah,
water. Where you get rose water from? The rice water. Okay. Nakira Barnett, congratulations and thanks for tuning in. So, ladies, listen, it has been, oh, Lord, I think I had a question before we go. I don't want to miss out on nobody's question.
We have another one. I guess we have the.
What treatment is good for early signs of aging, sagging cheeks? So, of course, this question is for Chloe.
I would say if it's early, if you catch it while it's early, you could book an anti-aging facial where we use products that help treat photo-age skin, fine lines, and wrinkles. If you wait for it to get like really bad, we'll have to do like cosmetic procedure, like PDO threads or even with the Botox and filler. So if you're scared of injectables, I would say start off with a facial first so we can use products to treat it before it get really bad.
Okay.
All right.
I hope that answers the question. All right, ladies, man. I'm sorry, but we out of time for the radio portion. So we're gonna close out from the radio for those who still on Facebook. You can get one or two answers in, and of course, we're gonna ask one or two other questions so you can win something because they say they have their bags full of stuff. All right. So If y'all think of one question from each one of y'all, so we can do some giveaways for the ones still on Facebook. So Facebook, you have an opportunity to just type in the answer in the chat. All right, you don't have to go through WhatsApp since we're off, because we wanted to focus on those who on radio. Want to give them a fair chance, because some people don't have Facebook. So we're gonna ask. They're gonna think of a question to ask you, and then you answer it via Facebook, and you get your prize. All right. So thank you to Dr. Ronnie and Chloe for being a part of your Lane Talk Show today. You two have been phenomenal, and everyone's saying great job, ladies. So I'm grateful for that. All right. For next week's show, we're going to be talking about menopause and marriage. Okay. All right. Hot man. Menopause in marriage. That's something, eh? But that could be a juicy show. So you want to tune into that for next week. So we're closing out now for the radio portion. And so we want to thank our sponsors, Sean Shoe Store and Accessories, Emmanuel Medical Center, DQ Bahamas, Lysol Disinfectant, Airwick, Del Monte, Fabulous Ronnie Hair Restoration Clinic, and Your Lane Life Coaching. Ready to transform your life and relationships? At Your Lane Life Coaching, we help women build strong marriages, purposeful relationships, and a God-centered life. From premarital coaching to marriage restoration, we guide you every step of the way. Book your session today. Give us a visit on our website, www.yourlanelifecoaching.com, or give us a call at 376-8689. Your Lane is waiting. Are you ready to walk in it? All right. So we want to thank you for those who are tuning in for the first time. If you've tuned in for the first time, thank you so much for being a part of the show. And to our continued listening audience, thank you for always supporting us. We appreciate you. And for those, guests or clients of Fabulous Ronnie, I know she's proud of y'all. I know she have a support team. They're always rooting for her. And for Chloe and her team, who's rooting for her as well. Thank you so much for lending or giving your support to these wonderful ladies. Thank you, Beats, for always holding it down. You've never disappointed. Well, yeah, you're never disappointed. No, I'm kidding. That was a joke. But Beats always on it. All right, he's always on it. I'm blessed to have him as a producer, and I pray that you were all empowered, educated, and encouraged today. And until next time, have a blessed Sunday, everyone. Bye bye, Radioland. If you want to win anything, you can go on Facebook so you can win something before you go. Bye. All right, so real quick, ladies, y'all have your questions. We don't give this out because we want to let y'all got to leave out with y'all answering, and I want to make sure the audience have something.
Okay, my question, knowing Fabulous Ronnie is definitely changing the trajectory of hair care in this country, give me 3 reasons why you should book a hair consultation.
Oh, that's a juicy one. Y'all must be getting one big prize for that. That's a juicy question. She said, why? Give her 3 reasons why you should book a consultation with Fabulous Ronnie. Okay. So let me ask you, while they're trying to find their reasons, right? Do you personally do the consultations, or you've trained staff to do the consultations also?
I personally do the hair consultations, but we also have a separate service. It's called hair assessment with my assistant. And so again, the price varies. The hair consultation with myself is $150 versus the assessment with her is $50. But I can assure you, you will come out with an answer. You will come out with solutions. You will come out with a plan.
Do you know, you don't got to put no names on there, but do you know if there are other beauty salons that do the same thing, like what you do? The specific thing that what you do.
Right there is, listen, let me say this loud. There is no other entity in the Commonwealth of the Bahamas that do what Fabulous Ronnie Hair Restoration does.
None.
Especially none.
Bar none.
Listen to me. I stand so strong and confident to say none. I say none. No.
None.
From the doors to the floor to the roof to the wall, none. Nothing that would, there you go. Nothing would be off. Of course, you have a whole lot of different, entities, but man, listen to me, we set aside.
Someone said I need to go get my edges back. That's one reason. Listen. Okay, but you need 2 more if you won this prize. All right.
To get a consultation.
Someone say I won't answer that so bad. You can't answer it, Yolanda. You done win something. You can't answer the question. Okay. Someone says, most importantly, everything is all natural. That's what I love.
There you go.
That's what I love. All right. So here's an answer. Someone says hair loss, to have healthy growing hair and a nice atmosphere to be in. You taking that?
I could take that, especially but because they talked about the atmosphere. I want to stress that we're very private.
Mm-hmm.
Taking off, your unit, your wig is very sacred,
Yeah.
especially to a lot of people.
Yeah.
But so I want to stress how private the setting is, and so that answers why yes.
Mm-hmm. I know someone in particular who stopped going to the salon simply
open.
because they have
Embarrassment.
very
Yeah.
bad alopecia, and so they would rather, if they don't have a salon that has somewhere private to go,
Mhm.
they wouldn't go at all.
Mm.
And so they just stopped going altogether.
Everything about Fabulous Ronnie Hair Restoration Clinic is private. To the shampoo bowl, to the assessment area, every area have privacy. And so if you have any discomfort in any way, trust me, I can assure you that you will feel very much comfortable.
So, Lavita Thurston won that.
Oh, Lavita Thurston with Lavita.
Yes.
Listen to me.
Listen.
That's my live cheerleader. Oh, that don't never let me down.
Well, child, she went in free tang, so she ain't gonna never leave you down. She
Tings,
ain't leaving you. Tings. Go.
She put a comment and said that she was trying to post a picture in the shot of her hair because it's thick like a cow.
Trying
It's a
to, right, I love
beautiful
that.
hair.
I love that. Thanks for
Excellent
answering
friend
and
and
congratulations.
client.
Write that down for me, please. So we will make sure we get all these people. Now, mind you, when you do get these, when you pick up these prizes, now that's up to them. You can either pick, you would rather them come here to the Guardian to collect it. I would love that because we would want to
A
make
photo?
sure that, yeah, the
Sure,
photo and
that's
stuff.
no problem,
All right.
man.
So when you do come, her name is Lavita Thurston.
Lavita
She
Thurston.
won, what did she win?
Lavita would definitely win a complimentary treatment. So she could just come in and just get pampered that day. So Lavita, she get a free treatment. And our treatment,
But she had to come here first to get
yeah,
the,
she got to get the certificate.
the
from
certificate,
Trish. There you
right.
go,
And then
she
she
could come and
get,
get the
right. Okay.
treatment. So Lavita, you coming to get pampered like usual, okay?
So I love that. I love that. Man, let me go try this guy's beats. What's up? The number? Oh, say something in there and say that's Trishon. All right, do that for me so I could win something. And so let's see if Chloe has a question. All yawns.
Okay, so you can name me 3 benefits of receiving a microneedling treatment for the last goodie. That's the last gift I have to give away.
Mm-hmm.
So 3 benefits of receiving a microneedling facial.
This one sound a little hard.
Mm-hmm.
Beat, you know the answer to that one?
I say this one
For
like
true?
3 times.
Okay. You said it 3 times. For some people, I know. Let's see. All right, you get, and what's your price?
The sensitive cream.
The sensitive cream.
That's for clients who have sensitive skin.
And what is the cream?
Okay, so it's a moisturizer
Mhm.
and it have SPF in it as well. So you definitely can add this to your skincare regimen after you would have already cleansed, exfoliant, moisturize. You can put on that cream last. You can use it in the night.
And can you, or only in the night? So you
In
can't
the
use it in the
nighttime.
daytime.
You can, but I recommend clients to use it in the night before
Okay.
they go to bed.
Okay.
Mhm.
What item or product should we use before putting the makeup on our face?
I would say cleanse, going in with a nice toner and a nice moisturizer to hydrate your skin.
Mhm.
You always want to make sure your skin hydrated before you start the makeup application. So we can have like a nice smooth, what we're really looking for a finish. So it will look nice and smooth, you know? So if your skin dry, don't just go on putting on makeup. Make sure your skin nice and hydrated before you start putting on your makeup.
One thing you didn't touch on during the show is what is the sort of recovery time in between the 2 treatments that you
The
mentioned?
microneedling.
Microneedling and the
Yeah.
microdermabrasion.
I love that,
Is that something you
question.
can get, like,
I love that.
twice a week, or should you get out once a month?
No. So
once a
with
quarter?
with the microdermabrasion, right? So like I say, we sand in the first layer of your skin. Your skin normally sheds after that happen, right? The healing process could take about a week or 2 weeks. 2 weeks after your results, I would let you know like when to come in. Now everybody's skin different, right? So some people get micro done every 3 weeks. Some people get it done 4 to 6 weeks. It depends on how your skin reacts after the first treatment. Microneedling is the same way. Now that treatment is much more in depth than a microdermabrasion because that one we using needles to like drag the first layer of your skin. So that healing process, your skin would shed. You can wear makeup. You can
No.
wear dots. You can do no makeup. You can use like harsh products like retinol, reddening, salicylic acid. So once those treatments are done, you definitely using gentle products on your face. And the downtown is like, let's say up to a week or 2 weeks. But like I say, once
that's
again,
long.
it depends on your skin too.
Yeah.
Some clients it's spunks up like they ain't get nothing. Then other clients just take long.
Mm.
But the results after those treatments is very nice.
So with the microdermabrasion, would you recommend like
Can they hear your questions?
I don't know,
Mhm.
but I'm still able to get the question.
Okay,
on the
so you could probably.
Mhm.
I'm assuming you would recommend some sort of aftercare similar to like if you're getting a tattoo, like
Right.
some
So
sort of antibacterial maybe.
right. So with the microdermabrasion, I tell them to use like sensitive cleansers. So a sensitive cleanser, a sensitive moisturizer. You don't have to exfoliate or use the toner because after that treatment is done, you don't really use too much products. So you just probably use a sensitive cleanser and a moisturizer for when your skin starts to shed.
Mhm.
The cleanser to wash your face and the moisturizer to keep the skin hydrated. So how a normal skincare regimen would consist of cleansing, exfoliant, toner, moisturizer, SPF, things of that sort. Once you get treatments in depth done, you wouldn't have to use all of those products.
Can I ask you what type of exfoliating
Mhm.
cream or whatever it is, the facial cleansers are
So
best?
exfoliants, it could be in liquid form or it could be like in a scrub form. The
Mhm.
exfoliant, that's not a cleanser, that's like a product that's used to release dead skin cells.
Okay.
All right. Me personally, I love turmeric. I know y'all let me say turmeric so much. I love turmeric
Well, it's
because
natural.
it have a lot of good
Everything in
benefits
it.
and the natural, and it helps with a lot of stuff.
Mm-hmm.
It helps with the dark shadows, acne scarring, blemishes, dark spots. So I always recommend turmeric exfoliants.
Mm-hmm.
As far as cleansers, it depends on your skin type. Then I'll be able to recommend. But if you have acne prone skin, I always say use salicylic acid, benzoyl peroxide. We have products for clients who have anti-aging, like fine lines, wrinkles, things of
Mhm.
that sort. And then clients who have sensitive skin, I'll just recommend like sensitive products.
Y'all ain't want this gift, man. Phoebe say, I can't answer the question again, eh? No, ma'am. So go ahead. Miss Thurston done win something, so I can't,
For the
I can't.
microneedling?
Did she answer that? But what did she
What
win?
she said.
Oh, she won something for you, but didn't win anything for. Should we still give that to her? For you. Okay, so let's do that then.
Okay.
All right, because what I wanted today, right? But what I wanted today were new people. So if
New
you want
people.
something in general, then but because nobody else, let me just make sure before I get myself in trouble. Um, someone say hashtag free Yolanda. That's funny. Yolanda, you can't get no more products.
Unless Yolanda won from me.
She
Mhm.
right.
Yeah, she did.
But how y'all get dictating how this thing go? No, but we can do that. We can do that. Let's do that. So we can give this. We could give Lavita. That's only because we wanted to have somebody else. Can I get a number for Sharron? Yes, you can. She's gonna recite a number. Both of them are gonna recite their numbers again before we leave. But Lavita, we're gonna give this to you. She says, "Beautiful skin, healthy looking skin, and natural looking skin." I mean, I know, cause I mean, all them sound the same to me. I mean, I don't know. We giving this to her. We doing what we doing?
You give it
Lavita, you're killing me, man. Lavita, you're cheating on this one, man.
I was looking for the answers to be microneedling. It helps with it reduces fine lines, wrinkles. It helps with acne.
Because I think that answer is
That's
too
the
vague.
biggest-
She gives it come all of what you just said.
That is not true.
No,
We got-
I want no.
Lavita, Lavita,
need to
listen to me.
know-
Let me tell
I
you
need to know
something.
the
This
benefit.
who advocating for you, okay? She advocating for you. No, but we can't get that beautiful skin,
I
healthy
want the
looking skin, and
benefits,
natural
man.
looking skin. I can't accept that. I can't accept it.
Oh,
Lavita, Doc tried for you. Yeah, she rooted for you.
I
But
should have probably say would make you a candidate
Mhm.
to get microneedling.
Okay, so what we can do, let's recite our numbers and then we're heading out. So we're gonna recite Doc, they want to know your number, and then of course, Chloe, you recite your number on social media platforms.
Okay.
Yes,
She
please.
can be contacted at 341 hair. It's easy. 341 HAIR. You can't go wrong with that number. Or 565-0228. 565-0228. We're on Facebook on the Fabulous Ronnie Hair Restoration Clinic. Like me, follow me. Fabulous Ronnie Hair Restoration Clinic. And on Instagram, Fabulous Ronnie 242. And we're also on TikTok. Y'all can see a lot of videos on TikTok, a lot of before and afters. TikTok, again, Fabulous Journey 242. But again, 565. Send us a WhatsApp say hi. My name is Jane Doe. Add me to your listing, and by you being a part of our listing, we have an exclusive WhatsApp group. So we run a lot of specials on WhatsApp, but that we don't run on Facebook or any other
Oh, wow.
platform. So you'd want to be a part of that listing.
Come on.
Five
Listen,
six five zero two two eight.
let me tell you something. I getting cussed right out on this platform. They round me right out. Phoebe say, listen. Phoebe say, what she say? Y'all didn't want me answer, man. And she gone with her little walking thing. Yolanda say, nah, Trish. And then Levita say, but they different meaning. Um, so what I'm gonna do is let's give Levita that, man. Let's give her that. Let's give her that prize. So what she come for? She come for 2 prizes. So write that down for me, Levita, get that.
There you go.
All right.
Levita.
Now y'all get anything for Phoebe? When Phoebe won, she won the sensitive cream. Because Phoebe said, y'all ain't want me answer. Phoebe, answer. Answer, Phoebe. Give Phoebe a question so she can answer it. Because she
won from
oh,
me or she won from you.
who did she win from already?
I think she won the nicenamide, so she won from me.
Okay.
Let me take a nicenamide and be happy, child.
That was the
Oh,
esthetician, right?
Yeah.
Okay, so
Oh.
we that's good. Y'all got some good prizes. Make sure I write that down because when they come for that stuff, listen, when y'all come, y'all have to come with your ID, please. Okay, bring your ID. Huh? Oh, you knew that? I didn't know that. Oh, okay, we'll talk about that later. All right, I didn't know that. Okay, so that's it. Okay, then beautiful skin, natural skin by using the products and a younger looking skin. Levita, you didn't win. Levita, Levita, you didn't win. Levita, give it to you. Levita trying to redeem herself. It's okay, sis. Yolanda say I'm mattress, and it sounds the same like the first one, right? So I don't know what she trying to do. Y'all, listen. Let me tell y'all something. Nah, hold on. What all y'all give Yolanda? Because it ain't for y'all to give advocate for Levita and only give Yolanda one gift. What else y'all got? Y'all got anything else for Yolanda?
Yolanda won.
Yolanda, what you win again?
But the Yolanda won.
Levita say I need that little thing. I don't
but that-
blame you,
I
child.
bet you,
Oh.
Levita.
What Yolanda get? Man, I can't remember. Yolanda, what you got?
She won something from Chloe.
Y'all gotta remind me what y'all get.
Was it someone else?
Yolanda say I need a gift from
I
Ronnie.
think that was-
Yolanda, you gotta answer the question from Ronnie. Ronnie, you got anything else to give? Because Yolanda says she want to give. I don't know what to
Just
do.
because it's Yolanda. Okay, hand me Yolanda.
Let me listen.
Yolanda.
Remember when I sent y'all a screenshot and I said someone say make sure your guests bring prizes.
That
Come,
was Yolanda.
that was Yolanda.
Oh,
So
really?
Yolanda, Beats, make sure write me, please. Say write my prize down properly, please.
I remember she got.
Phoebe, that's Phoebe. And NJ say rice water. But NJ ain't NJ. What y'all doing? Y'all trying to confuse me? Let me get out here. I go
Oh,
on.
no,
NJ, you ain't win nothing.
Akira Barnett won the rice water.
Yeah,
Okay.
she won the rice
Okay,
water.
that's good.
So
Beat, you gotta write them
Oh,
down.
that's them and we related.
No, Nakira
Yolanda
Barnett.
say, oh, get it together.
The person's name is NJ Barnett. So
See,
they
I
got
don't know that. See, I trying to advocate for all the
Yeah,
y'all.
yeah.
So there's one more prize. That's what you're saying? One more giveaway?
turmeric scrub.
Yolanda won the
The turmeric
turmeric
scrub.
scrub. Okay, good. Make sure you write those things down. So when I tell the receptionist, so she'll know. Well, I'll write the names on the stuff for them. You don't be writing like them doctors say Beats.
I feel my
All right, we gone, man. I try to get something for everybody. I hope everybody happy with what they got. Someone said give Yolanda some juice. So I hope everyone's content. And I want to thank you for this is the after party. This is what we call the after party. After we done finish, and then we just do. And I love it after these shows because sometimes you get all the juice, all the information, some things that we forgot to say on air that we normally say here, but we gone, man, because it's time to go. Make sure you have your IDs with you when you collect them. And of course, you'll be collecting them from the Nassau Guardian, which is located on Carter Street, and as we used to call Oaksfield, because it ain't called Oaksfield no more.
No.
It's still called it's still named Oaksfield. It ain't Oaksfield no more.
Everyone knows.
Nobody say Oaksfield, but
Oaksfield.
it's Carter Street. But
Street.
yeah, but him should say Oaksfield. So it's Oaksfield. That's opposite KFC restaurant. Okay, and you'll know that you'll be right there.
Yeah.
All right, so and then of course someone say, hey, Chloe, this person a little late. This Kristen Nesbitt. Hi, mommy.
Hi, Mom.
So I want y'all to I forgot my train of thought. I forgot what I wanted to say. I forgot what I was gonna say, y'all. Oh, so bring your ID so that you collect your prizes. And then WhatsApp me too, please. WhatsApp me so that I can ensure that I have everything labeled and listed. Beats is gonna give me that information as well. But still WhatsApp me to let you to just to confirm everything. Yolanda says thank you. And I'm sure they all say thank you. And someone said, thanks, you were a great host. Thank you so much. I appreciate it. Thank you for staying. We gone for true this time, okay? So God bless you. I just got an email from Patrice Lockhart just now. She can live long. So she'll be the one coming on board with us next week talking about menopause and marriage. That's a juicy topic. For everyone who's married or premenopausal or in the process of having menopause or whatever, if you want to tune into that show. And just because we use the term marriage, I mean, you're in relationship, so it's the same thing. So you want to tune in so you can know how to deal with that. Because there's be some hot flashes, there's be some mood swings, there's be all this, you're hungry all the time, or you're always thirsty. Some always wrong. So you want to know how to deal with these issues so that you don't push the man away. Okay? So we're going to come, ladies, that's what we're doing. That's what we're doing. So 376-8689 is the number to text. 376, that's the person asking the number, if that's what you're asking for from me. And then for Chloe,
You can contact me at 816-1338, Instagram Zoya Chanel's _ skincare, and on Facebook Zoya Chanel Skincare.
and Fabulous Ronnie, Dr. Ronnie.
341 hair, HAIR, or 565-0228. Or you could also check us on, we have a website as well, Fabulous Fab Hair Clinic. Sorry, www.fabhairclinic. You'll be able to shop online and get our products.
Oh, why
Have it done.
not?
Of course.
Oh, okay. I
International
absolutely
shipping
love
as
y'all
well.
TikTok videos, by the way.
Oh
And they're
my.
so funny. I absolutely love it.
Thank
We
you.
gone, man. We gone for true. All right. Blessings to each and every one of you. Have a beautiful Sunday. I pray that you were all encouraged, empowered, and educated today. And I'll see you next week, God's willing. Deuces.
Deuces.